Well, let's move now to the Upper West region, where Acting Dean of the Faculty of Planning and Land Management at the Simon Diadon University of Business and Integrated Development Studies, Dr. Kennedy Alatinga, says the woes of herd porters in the country continues to worsen because successive governments have failed to address their challenges. Delivering findings of a research he conducted at the dissemination workshop, Mr. Alatinga recommended challenges of herd porters should be addressed through targeted policies and programs to avoid creating an intergenerational cycle of poverty among them. Correspondent Rafiq Salam has more.
The acting dean of the Faculty of Planning and Land Management at the Simon Diadon University of Business and Development Studies, SDDU, Dr. Kennedy Alatinga, did not mince words on how successive governments have failed to address issues of herd porters, popularly known as Kayeye, in the country.
This failure to have a long-term political perspective on the issue of Kayeye results in what I would describe as the privatization of human misery. Why do I say that? We are privatizing human misery because these people are youngsters. These people, as 10 years, are fending privately for themselves. And everybody looks on. Most often it's the media who just say, oh, Kayeyes are suffering. But this is actually not gaining serious and political attention.
Opening up on a research he conducted titled Adolescent Girls on the Move, Poverty and Access to Health Care among Migrant Adolescent Girls Herd Porters in Ghana, and attended by Dean of the various faculties, senior lecturers, students and the media, opined that education, health and economic well-being of herd porters are important and should be addressed through targeted policies and programs to avoid creating an intergenerational cycle of poverty among these unfortunate people. The senior lecturer made a couple of recommendations for the Ministry of Gender and Social Protection and the National Health Insurance Authority in order to ameliorate the sufferance of herd porters in the country.
So we have seen that from the findings, the Kayeye business actually impoverishes, makes the Kayeyes poor, because when we measured the out-of-pocket payment, about 89% of the Kayeyes pay out of their pockets for healthcare. It means that this group of people do not have active health insurance. Meanwhile, if you look at them, about 51% of them are between the ages of 10 and 17. And this group of people should actually be exempted from paying annual premiums, because the National Health Insurance Policy mandates that people of this category should be exempted from paying insurance premiums. Yet, they do not have. So this is clearly an issue of a policy failure that the National Health Insurance Authority and also the Ministry of Gender and Social Protection will have to take into consideration.
Dean of the Faculty of Integrated Development Studies, SDDU, Professor Paul Nkegbe, lauded the idea of disseminating to the public research findings, which hitherto the academicians have been accused of doing by shelving to gather dust. The Council for Development of Social Science Research in Africa, CODESRIA, under the African Diaspora Support to Africa Universities Program, funded the research. Reporting for JoyNews, Rafiq Salam. Wow.